Welcome back to Desk Careers. I am so excited to be bringing an incredible guest. Today we are meeting with Andria Calicchio van Niekerk, who is the speech pathologist and audiologist at Neuropedia Children's Neuroscience Center here in Dubai in the United Arab Emirates. Welcome, Andria. It's so great to have you with me.
Thanks so much for inviting me for this. I'm quite excited.
I am so excited. I believe you might be my very first speech pathologist and audiologist in all of my career as a careers practitioner. So I'm so excited to have this conversation. This month is all about connecting the dots for our aspiring medical students with professionals in the medical industry. And I know that at Neuropedia, you're specialized around children's health and the needs of children. But I believe that the journey towards where you are today probably started along lines, anyone who wanted to be in the medical profession, going to medical school, the whole ethic behind the practice and the study. So I'm very, very excited to be talking to you and also to help our students become aware of specialties. And I think this is something we really haven't focused very much on. I believe that young people think, I want to be a doctor, or I want to go into the medical industry, but they rarely really think about the specialism that they may be wanting to pursue, which could help them in gaining work experiences and taking on opportunities. So let's get started. Andria, I want to go right back to the beginning of your career, right back to high school. You mentioned that the whole process of applying and the interview was intimidating. And I believe you described it as long and tough in the exam process, and that the interview was intimidating as a high school student. So watching this right now will be young people resonating with that fear that you described. So can you tell us a little more about your personal experience?
I think for me, it's also because you, like you said, you want to be in a medical profession and you want to go into the medical profession. But there are so many areas within that we actually don't even know about. You also don't know the detail of what really happens when you're working with different people or when you decide which area you want to go to. As a high school student, you do biology, you do science, and you think, oh, well, now this is what I want. And I've been to the doctor before, or I've done a little bit of shadowing, and this is the area I want to go to. But you don't really know the in-depth of what they're going to ask you when you go for an interview. The university is not just going to let anyone in because this is what you want to do. And, oh, yeah, I'm so excited to be a doctor. I'm so excited to be a physio or an occupational therapist or a speech therapist. That excitement, they want to see that, but they also want to see the real you and the real reason why this is what you want. And they ask you those questions. And you think you're prepared, but you're not always prepared because these are people who are going to basically dictate the rest of your life. They're the ones who are going to decide, yes, you're going to be in this career that you've dreamed of being in, or the ones who tell you, you know what, you're not ready, or this is not the correct path. So that can be very intimidating. They're not there to be your friend. It's not like when you're at high school and all the teachers, they're very loving, they're very caring, they want to help you, and they really care about your feelings and the day you've had. At university, they don't have time for that. They are creating people who are going to be the future. So you need to take that into account. And they use these interviews to make sure that whoever they choose are the correct people for the group, that they're going to basically mold and going to be the future doctors, the future physios, the future speech therapists, the future audiologists. They really do look into areas that you wouldn't think was going to happen. And they ask you those deep questions that you didn't prepare for.
How do you prepare for that? I know that young people think it's going to be really scary, and they focus very heavily on their academic studies and getting the grades. But how do they prepare? So going back to your experience and going through it, and now being a professional in this field, you must meet young people every day that are telling you, Andria, this is what I want to do. What can you offer in terms of support to students in giving them more of an awareness of like, listen, really pay more attention to these key areas. I didn't know, but now looking back, I think I should have prepared more for these key areas?
Academics is definitely important. Focus on your academics. It's really important that your academics are focused on, and how you learn, because you go from textbooks probably about that big to a textbook about that big. So yes, academics are important. So don't think that, oh, you kind of cruising through your academics and you study hard and okay, well, I know I'm going to get in, I'm doing well. You need to make sure you're on the top all the time. And what I can say is, when you study, what is important is don't parrot fashion learn what you've got in the textbook. Think about how you can apply what you've learned, because parrot fashion is not going to get you anywhere in life. You need to understand and fully know what they are trying to teach you and how to apply it, because that's what being in the medical profession is. That's actually what being in any profession is. You study and you have to apply what you study. And unfortunately, the world is not textbook. So those textbooks are guidelines, but every child is different. Every person you meet, every parent, every teacher you meet, they're all different. And you need to take the knowledge you have and adapt it and apply it. And that's something that you can start learning in high school, because sitting down and memorizing everything is going to get you an amazing grade. But did you really understand it? Are you going to be able to teach your friend tomorrow what actually needs to happen when your friend comes to you and says, I have no idea how to do this and I'm so confused? Can you teach them, or are you just going to recite to them? And that's what being in the medical profession is about. It's about taking the knowledge you have and adapting it and applying it to every single person you see, because I'll see 10 patients in one day and every single one is different. They might have the same difficulty, but the way they learn, the way they interact, the way they play, the way the parents interact with me is all different. And you need to be able to adjust to all of that. So start with your academics. The other thing that I can say is, if you do go shadow someone, ask them questions. Don't sit there smiling, taking little notes and asking them, so how was your day? And, oh, what's wrong with this child? Ask them, how did you plan for the session? How did you come up with that diagnosis? How did you do it? Ask them the how, not the what. And that's going to make it more clear about if this is the profession you want to go into, and make you more prepared when you do your interviews, because then you can start giving those answers. You can say to the people, well, when I went to see this doctor and they had this patient, I found this very interesting. I asked them these questions, because then the people can see, who's ever interviewing you, that this is what you want to do, because now you've gone more in. You haven't just gone and said, oh, well, I shadowed a doctor. You've asked questions, you've been able to give answers, you're showing what you're learning and what you're seeing, and that this is really what you want to do. And the other thing is, don't just go to private practices. It's very easy to go to a private practice because everything's all pretty and glorious here. But go to a government hospital, because that's where you're going to start. Go to a government hospital, not a private hospital. Go into the government hospitals, the clinics, the places like that, where you're really going to see what happens. And that's where you're going to start before you can specialize. Before you specialize, you have to go full depth into the most severe cases, the cases where people don't have the ability to do all the tests they need or have the treatment they need. And now you have to come up with a way to help them. Government hospitals are definitely one of the biggest things that I would say go into and shadow those type of doctors, those type of therapists.
That's great advice. So be really proactive in your learning. Don't just sit passively in a classroom and memorize information.
Yeah.
Learn how to apply it. And of course, be very proactive in your work shadows and observing outside of the comfort zone of private medicine. Fantastic. Let's go into your current role. What does a speech pathologist and audiologist do? And I know that you're the head of your department as well, and you oversee the different therapies. So maybe talk to us about the role before you became the head of a department, and then how and what you did to attain that role of head of department.
So I first started off obviously as a junior therapist, where you're doing a lot of assessments, a lot of therapy. When I was still back home, I worked with adults and children within hospitals and rehab centers. Moving to Dubai, I decided to specialize in children because I like to play. So with children, we play games the whole day. Even my husband says that between the car and the house, we have a nice toy shop happening. But that's the reason I decided to work with children, because children learn through play. So I play the whole day with children and teach parents how to play with their children and how to get communication out of their children through play. So we do assessments, we do therapy. What is nice about where I work, we're a multidisciplinary team. So we have the OTs and the ABA therapists, psychologists, physiotherapists. We all work together in helping children develop their skills, because children are a whole. They're not separate units. You have to see them as a whole, and they learn as a whole. So I do a lot of that, and I started as a junior therapist, just basically doing assessments at the clinic, at schools, and developing therapy plans and giving therapy and home programs to parents. It's 14 years of experience that I've had and 14 years of working, where I've started to specialize and further my studies. Even as we speak, I'm busy doing 2 separate courses to furtherize and really become specialized in what I'm doing. With speech therapy, for example, there's a huge area that you can do. It's a massive umbrella of different specialities. So becoming more specialized in areas that you really enjoy is the best way to further your career, because you become known as the therapist who can do these sorts of things. Develop to become a head of department and develop into a more managerial role, you really have to come up with new ideas, new projects, new ways of furthering not only yourself, but the profession you are in. And by doing that, you really get yourself into a position where you can start overseeing things because you've shown you're able to do it. So even when you are qualified, don't just stay still. Don't go, well, now I'm a speech therapist and I just do everything. And yay, I see children or I see adults. Start specializing, start coming up with new ideas, new ways of furthering the profession, not just yourself.
Incredible. Let's go to what inspired you to become a speech pathologist and audiologist. I know that you grew up and your father was an inspiration to you. Mm-hmm. Tell us more about that story. I believe that this type of story is really something that our students will resonate with, because many of them will connect what they want to be doing with something that they've experienced or they've observed as they've grown up. So talk to us about why you went into this field and how your father was an inspiration.
So my father he had polio when he was little. So his left leg doesn't basically work the way ours do. So he wears a brace on his leg and he walks with a walking stick. So growing up with a father like that, I never noticed differences. I never realized my father was different. Or if I saw someone in a wheelchair, or I saw a child who was walking differently or spoke differently, I didn't notice it because I grew up with a father who apparently was different. Only when I reached high school, and children, and I'm sure a lot of children do experience this, where bullying comes in, you could say, or very nasty comments come in. Only then did I experience people mentioning my dad. Never noticed it before. Funny story that my parents always tell. My parents were called in when my sister was in first grade. Teacher was very concerned, called my parents in. And when my dad walked toward her, she was like, oh, now I understand. Because my sister drew a family picture with my father holding a walking stick. And she was concerned that something was happening at home, because that's how we drew my dad. He has a walking stick. So it's different for me, because I saw someone who strived to be the best he could and didn't allow any differences in his life or any difficulties in his life to prevent him from getting to where he wanted to be. And he always taught my sister and I that that's what you need to do. You can't hold on to what makes you different, or things that make you different, or things that you find difficult, and use that as an excuse to not pursue what you want to be one day, or use it as an excuse to get attention or sympathy. So I wanted to be in a profession where I could help children or help adults even, or anyone, to show that, yes, you might have a difficulty. Yes, things may be difficult for you, but I'm here to show you ways to overcome those difficulties. And that comes straight from my dad. So, he taught us to strive for everything. He is a very well-known lawyer back home. Very well respected, and it's because he didn't allow any difficulty that he faced to hold him back. And that's what I want to help. That's what I decided to help people with, to use their strength to overcome their weaknesses, basically.
Was this how you talked at your interview when you were back in high school, when they probably asked you, Andria, why do you want to go into the medical profession? Was this something that you brought up? Because I could sense that passion and that big purpose behind the why you want to be doing it. Would you say that that's something that you would have prepared for, or would it have been very natural because deep within you, this was the why you wanted to go into the practice?
I never really prepared for it because it's who I am and the reason why I'm doing things. And I always say to any student who comes and asks me questions, I always say, don't fake what you want to do. Don't come up with a story because it sounds amazing. Talk about you. Talk about why you really want to do it. Because when someone asks me why I'm in the profession I'm in, it's very natural for me to answer. And I'm sure it's very natural for any teacher, any nurse, anyone to, if you ask them truly why you're doing what you're doing and you answer the truth, it comes naturally and it's very easy. If you try and make up a story to impress someone, you're really not impressing anyone because they're going to see right through it. So tell the truth, just tell why. And if you think it's a silly reason, it's not. It's because that's the reason you are doing what you're doing.
Incredible. Many young people think that when they have to write up a letter of application to the university or they want to show experiences, that it has to be with a doctor, in a clinic, in a center. Would you say that there are other ways for young people to gain experiences that would help them gain those transferable skills that you need? For example, I heard you saying, very often I sit down with parents and I teach them how to play with their children. Or I'm meeting with my team. We don't just help a young person in isolation. We have to look at, working together with the other therapists and understanding how to help this child. So I'm almost hearing, I need to really enhance my ability to communicate. I really need to enhance my ability to listen carefully. Would you recommend other ideas for students rather than just trying to get work experience in a clinic with a doctor that could help them write that letter of application and show their interest in the practice?
When it comes to children, adults is very different, but let's start with children. Children, for example, go into a nursery and volunteer, go play with children, and go into schools, talk to the teachers, because they're the ones who also see differences in children all the time. Don't only think, well, if I want to be a speech therapist or I want to be a doctor, I need to go spend time with those people. Go spend time with other people who work with people. So for children, it's nurseries, it's go volunteer at a soft play area, see how children are, go to the schools, go to anywhere, even if it's something like, it sounds silly, but somewhere like IMG, go volunteer and see what happens with children. When it comes to adults, if you're more thinking toward adults, go into places where other adults who have additional needs are. So retirement villages, places in hospitals where they're helping with assisted care. Go into those places and interact with different people, because you don't only sit in your therapy room. You don't only sit in your doctor's room. You go to different places, because that's the main aim of any medical profession. We're trying to get people to be independent within the environment they find themselves. So go to those environments, because therapy is not about our room. Being a doctor is not about being in your room. It's about helping those people cope out of your room. So go out the room. and go see other people there as well. Even be a receptionist somewhere. Go volunteer and be a receptionist. Let it be at a law firm or at someone's clinic as well, if you want to, or anywhere. Go be a receptionist and interact with people and see how, because that is what being in actually any profession is interacting with people. If you don't enjoy interacting with people, you definitely cannot be in the medical profession, because that's what you do.
Amazing. Andria, I know that your top 3 career tips are be passionate, learn every day, and stay humble. Why are these your top 3? Well,
you have to love what you do. That you spend your whole life doing it. You spend your whole day doing it. I don't go home and although in the afternoon, yes, I go home and spend time with my toddler, but you don't go home and your job ends. You don't close the door of your office and then that's it. You're still thinking about what you have to do for the next day, or you're writing reports, answering emails. So if you don't love what you do, getting up in the morning is not going to be fun. Also, if you don't love what you do, people sense that. And what you put out is basically what people see. If you don't love your job, nothing's going to be productive in your job. So you need to really be passionate about what you do. And when you start losing your passion, you need to find something that will build it up again. So that means doing an extra course, going to a seminar, taking time off work. That's what holidays are for. You have to be passionate. In terms of increasing your knowledge, everything changes every day. You have to go with the times and learn things, because what I learned 16 years ago at university, ways of doing therapy and new approaches, it's all changed compared to there. I mean, I think about the hearing aids that I fitted when I was in university. They don't look anything like they do now. So you need to constantly update your knowledge, constantly learn. And it's the reason why, as medical professionals, and I know a lot of other professions as well, you have to do your CME points or your personal development points. It's to keep up with what's going on. And the big thing, be humble. You don't know everything. If you will never know everything, and you need to rely on other people. Let it be from someone who is helping you clean the floor after you've done a feeding assessment, to the receptionist, to your colleagues. You need to learn from them all the time. And if you come across as what I call a bulldozer, you come across, I know everything and I'm the best and I'm this. People might smile because they're being professional, but you're not going to be the person that they're going to pick up the phone and go, oh, I need your help, or tell you something new, or involve you in a case. They're going to be the people that they want to avoid you. And that's not how you want your profession. Yes, you have to sometimes stand up, depending on your role, stand up for what you believe, stand up for the knowledge you have, but you are never better than anyone else. And I think that's the biggest thing. If you can keep that in your mind, that I'm never better than someone, it's going to keep you going in your career as well.
Fantastic. We've learned so much today. Thank you so much, Andria. What I'm taking away from this interview is for a young person to really be able to identify the why they want to be going into the medical practice, to stay active and be in that driver's seat of your learning and gaining experiences. And don't sit passively and kind of observe, but ask questions. Ask, how did you come up with this? Or how did you come up with the diagnosis? Is one of the examples you gave us. Yeah. Stay in that learning journey. You're always learning, you're always evolving. As you said, things change very quickly. Technology is changing, and we have to stay on top of that as well. What an incredible interview. Thank you for being here with us today. Thank you for your time and for your experience. Just before we say goodbye, if you had to do it all over again, Andria, would you do what you're doing today?
In a heartbeat.
Amazing. Thank you. That was Andria Calicchio van Niekerk, and she is currently the head of department, but she comes to us today talking about being a speech pathologist and audiologist and her career journey from Neuropedia Children's Neuroscience Center and Dubai English Speaking College. Thank you for being here, and we'll see you at our next Desk Careers Digital Spotlight.
Bye.